Sadness is something we all experience. It is a normal reaction to difficult times in life and usually passes with a little time. Depression, however, is a longer state of sadness, which is debilitating and interferes with daily life and normal functioning. It can cause pain for both the person with depression and those who care for that person. It is a real illness. It is not a sign of a person's weakness or a character flaw. You can't just snap out of clinical depression. Most people who experience depression need treatment to get better. With over 350 million people affected by depression worldwide, it is no doubt an incredibly real and serious issue. Therefore, it is so important to stay informed and spread awareness of the signs, symptoms, and treatments of depression. Major symptoms of depression include feelings of persistent sadness, anger, guilt, or hopelessness. Depressed individuals also tend to show signs of social withdrawal, lack of energy, low motivation, and changes in appetite. In order to be diagnosed with major depressive disorder, these symptoms must last for 2 weeks or more. Normal and expected sadness brought by a negative event, such as a loss of a loved one, should not be diagnosed as major depressive disorder unless other symptoms are present. Persistent depressive disorder is a more chronic form of depression and it is diagnosed when symptoms persist for at least 2 years. Over 70% of people diagnosed with depression have another psychological disorder at some time in their lives. Many factors play a role in the development of depression. In the past, depression was solely attributed to a chemical imbalance in the brain. Scientists believe that simply reduction in the amount of the neurotransmitter serotonin was to blame. However, the only evidence for this was when patients were prescribed medication which increased serotonin levels, it helped alleviate their depressive symptoms. With increased knowledge of neurotransmitters, theories of depression have become much more complex. Scientists have further discovered that brain structures and neurons that release neurotransmitters may play a larger role. Depression may stem from less sensitive serotonin receptors or malfunction of neurons. In studying the brain of a depressed person, the hippocampus, which is critical in memory and emotion, tends to be smaller than normal and has less activity, which results in chronic arousal of the body's stress response, causing depressive symptoms. While neurons and chemicals may be direct influencers in depression, many genetic factors have been discovered as well. Family history studies find that first-degree relatives of people with major depressive disorder are 2 to 3 times more likely to also have depression than are people without the disorder. Twin studies find higher concordance rates for identical twins than for fraternal twins, further implicating genetic processes in the disorder. Some studies show that microbes may have an impact in the development of depression. The 3 pounds of microbes that we carry around in our bodies are critical in making different people who they are by affecting our behavior and our mood. In early life, our gut microbial community is growing, and any disruption to this community may have a profound impact on our mental health later on. There have been recent experiments on this involving exposing different mice to stressors. Neonatal stress in mice leads to increased stress reactivity and gut dysfunction that changes the gut microbe community, which in turn alters brain function. It is often difficult to pin down the true cause or causes of depression, but it is important to remember that depression has a biological basis and may have psychological and social implications as well. Untreated depression can lead to serious complications and put one's life at risk. Fortunately, there are a wide variety of treatments. However, only about 60% of people with depression in the United States seek treatment, and many fewer seek treatment in developing nations. Most of the biological treatments for depression are drug treatments that alter levels of neurotransmitters, which reduce depression in about 50 to 60% of people who take them. Psychological treatments include behavioral therapies that increase positive reinforcers and work to change negative thinking patterns. The most effective way to decrease depressive symptoms is to use a combination of biological drug treatments and psychological therapies. It is important to encourage those who suffer from depression to seek therapy because it is not simply a weakness that they can overcome by themselves. Shedding light onto the subject of depression is imperative in order to bring funding to develop more efficient treatments and promote further research.